Ladies and gentlemen, please welcome GPhA Chairman of the Board, Tony Mauro.
Well, good morning, and welcome to the 2013 GPhA Annual Meeting. I'm Tony Mauro, President of Mylan North America, and over the last year, I've had the great pleasure of serving as the Chairman of the Board of this fantastic association. I'm honored to have been elected to serve a second term at yesterday's Board of Directors meeting. Thank you much for the opportunity, and thank you all for taking the time to attend this important meeting. The GPhA team has prepared a wonderful lineup of informative sessions and speakers over the next 2 days, and I encourage everyone to take advantage of all the facets of this event. 2012 was a great year for the GPhA and for our industry. As an association, we made outstanding progress transforming our vision into action. This year, for example, we learned that the products and services that our member organizations provide help to save the American healthcare system more than $1 trillion over the past decade, a record figure that averages out to more than $1 billion every other day due to the expanded use of generic prescription drugs. And while these savings speak volumes about the robust growth opportunities available to our industry in a market that continues to discover and understand the true value and reliability of our products, the figure also highlights the importance of continuing to improve how healthcare is delivered in our country by helping to further reduce costs while expanding access to high-quality medicine. In July, we took a giant leap forward when President Obama signed into law the Food and Drug Administration Safety and Innovation Act. Included within FDASIA was the landmark Generic Drug User Fee Act, GPhA, which will provide FDA with approximately $1.5 billion over the next 5 years to ensure backlog reduction, accelerate the ANDA approval process, and to support facility inspection parity through risk-based assessments. This legislation will help to establish one high-quality standard for all pharmaceuticals utilized in the U.S. by empowering the FDA to ensure all drug manufacturer facilities that supply the U.S. market are regularly inspected, regardless of whether they're based in the U.S. or outside our borders. Again, all with the end goal of protecting the health and safety of consumers. The entire generic industry stepped up to the plate to help provide FDA with resources in order to address many of the industry-wide challenges we face, especially pertaining to an increasingly globalized pharmaceutical supply chain. It wasn't always easy, and it took a lot of teamwork and dedication from the companies represented in this room today to bring this law to life. But without a doubt, the American patient will be better off for it, and for that we should all be very proud. Additional accomplishments to highlight for 2012 include the new members that joined GPhA, record attendance at our association conferences, including the annual meeting, CMC workshop, and fall technical conference, our continued efforts in fighting back against the ban on patent settlements, and success in defeating more than 300 anti-generic proposals at the state level, our ongoing participation with the fight against poorly designed trade policies as part of the Trans-Pacific Partnership negotiations, and last but certainly not least, our increased media coverage. I applaud the work of our member organizations, the GPhA Board of Directors, the entire GPhA staff, and GPHA's President and Chief Executive Officer, Ralph Neese, for their hard work and leadership in helping us achieve some great milestones in 2012. Bringing a vision like ours to life is no simple task. It requires an incremental, sometimes painstaking implementation of actions that support our cause. As an association, we must continue to invest our time and energy in this effort to ensure our future success. In 2013, our priorities will continue to evolve. For example, we must shift our focus from passing GPhA to successfully implementing and enforcing it. Additionally, our efforts must continue focusing on creating transparent federal and state regulatory frameworks for increased access to generic drugs, including the creation of a viable approval pathway for interchangeable biologics in the U.S. To be sure, GPhA has been working very hard on this front. Through various presentations and testimony at the FDA, GPhA has pushed for a regulatory scheme that is based on science, ensures patient safety, and is not a barrier to competition. This, in turn, will lower costs, increase patient access, and spur future innovation. GPhA will continue to work with FDA throughout 2013 on critical biosimilar issues such as naming and interchangeability. We also will continue our efforts on the state level to avoid any baseless attempts by innovator companies to establish unnecessary barriers to substitution. Some may say that the obstacles are too many and that our industry will be too hard-pressed to overcome them. But that is also what they said in 1984 when Hatch-Waxman was first enacted. And look at our industry today. With our shared vision and relentless energy, if anyone can and will succeed, it's us. It's important to remember the critical role our industry plays in helping to provide Americans with affordable and sustainable healthcare solutions. Moving forward, governments, payers, and healthcare providers will most definitely continue to seek ways to further reduce costs. And based on many factors, including the impressive savings we have offered to date, the generic industry is uniquely positioned to have a voice in this important national conversation. In addition, there are many other issues we must continue to address as an association. For example, we need to continue to work to protect our option to enter into patent settlement agreements to help bring lower-cost drugs to markets, once again benefiting American patients. And we will continue as an industry to do everything we can to achieve a stable supply chain ensuring reliable delivery and availability of generic drugs. Overall, we will need to work together with all involved to continue educating patients, prescribers, dispensers, and payers on the safety and efficacy of high-quality, more affordable generic medicines. All of this while providing passionate leadership as a member-focused association comprised of dedicated companies to advance policies that strengthen each of these efforts and fight barriers that seek to limit access to generics overall. Continuing to ensure the ongoing development of a successful generic drug system in the U.S. depends on all of us. Together, we will accomplish our goals more strategically and efficiently, and the association needs your support and your voice to succeed. By further diversifying our membership and making our organization more sustainable, we will better position GPhA to champion our meaningful message, which is continuing to translate this vision into action for expanded, more affordable access to life-saving generic medicines. I thank you again for your ongoing dedication and commitment to GPhA in 2012, and look forward to seeing what exciting developments 2013 will bring. At this time, I would like to introduce the President and CEO of GPhA, Ralph Neese, who will provide us with some remarks regarding his perspective on the state of the industry. Thank you all and have a wonderful meeting.